Today, our plan of surgery is slightly different than our normal body lift. Our patient has previously had a tummy tuck and she's very happy with her tummy tuck results. And therefore, we are just going to help her to get her outer thighs and buttock areas lifted. So the plan of surgery would be to put a low cut incision in the front, but in the back, it's a buttock lift incision. This is our upper buttock lift incision, this is the lower buttock lift incision, and we're gonna take this and bring it up here. And with that, you do get a little bit of flattening of the buttocks, and then we're gonna go all the way around, complete the buttock lift, and then what really kind of makes her not super happy with her lower half is her thighs, and we're gonna do an outer thigh lift. Here I'm removing about 4 to 5 inches, and actually at the time of surgery probably will remove a little bit more than this. These are always my conservative markings at the time of surgery. I may deviate by about ½ an inch or more if I can. So we're going to be cutting all of this tissue. It's going to be skin, and about ½ an inch of fat underneath the skin will be removed all the way, as a result of which is going to get a buttock lift and then outer thigh lift. And on the front, if you cover your breasts for me, on the front, as we rotate her, we're going to do an outer thigh lift with which she will get waist reduction. This is her previous tummy tuck incision that's going to get cut out like that. And then as we come to the front, we'll terminate her incisions where her tummy tuck incisions were previously. Very nice incisions. So we're gonna bring these together, and that is gonna correct some of the laxity of the thigh fronts. Obviously, when you do an outer thigh lift, you can't just finish the incision here. You have to taper the incision forward and remove the excess tissue. And by the virtue of doing that, she's gonna get some improvement of her thigh fronts. So we plan this as a 2-stage surgery, meaning that today we're going to do a buttock lift and outer thigh lift, and then in future we're going to come back and do large volume liposuction of her upper back, mid back, and lower back, and actually contour and sculpt her lower back and create a nice, beautiful lower back concavity and waist concavity, and use that fat to augment her buttocks. So normally I would be doing buttock augmentation at the time of a buttock lift, but today we're gonna give her a better result by doing a 2-stage surgery, because once you do the buttock lift and she heals, then I can do more aggressive liposuctioning. And by aggressive, I don't mean really aggressive, I mean more complete liposuctioning of her whole back, and use that that fat to augment her buttocks. I'm finished with the buttock lift and a good portion of the outer thigh lift. Most of the outer thigh lift from the back has been completed, and you can already see the immense improvement in her outer thigh shape. The buttock lift has also been completed. Today we did not use lower back fat pads or liposuction fat to augment her buttocks. We just did a buttock lift. A buttock lift, as a result, typically causes small amount of buttock reduction, so you get smaller buttocks. I preserved a good amount of the fat lower back area so that the upper butt continues to be still full. And the plan is to do a 2nd stage on her, whereby we will come back and liposuction the whole back area, do a 360-degree liposuctioning of the abdomen and the back, and transfer all of that fat into her buttocks once it has healed. So that would be about 3 months from now. But as you can see now, The buttocks are lifted, all the wrinkles and the cellulites and the dimples are smoother, but it is a little bit smaller and it does need more projection and enhancement and reshaping, which we will do in the future. I'm gonna rotate her and complete the rest of the outer thigh lift in the front and do a little bit of her previous tummy tuck scar revision together so that we can get a nicely tapered incision. So we are not done with our outer thigh lift in the front. We actually removed the rest of her, so we actually ended up cutting her old abdominoplasty scar, starting at the pubic area. That you see some of the scar from the previous abdominoplasty here. So starting from the pubic area going outwards, we cut the rest of her scar out and we lifted the front of her thighs and the outer thighs, joining the back and the front incisions together and tapering that incision, as a result of which she gets enhancement and lift of not only the outer thighs, which was planned, but also the front of the thighs will be lifted to some degree. So that's her new thighs.